Hello, everybody. My name is Dr. KimBlake. I'm a professor of pediatrics at Dalhousie University here in Canada. We're right on the east coast of Canada. I've been here now for 22 years. I work at the IWK, which is my health center. So I have two areas of my life. One is a clinician, so I'm a pediatrician, and I see lots of young individuals with CHARGE syndrome of all ages, and I've become the CHARGE expert here, and so I get a lot of calls from Boston Children's and from sick kids in Toronto. I'm always very impressed with them when they have to phone me to ask me questions. And then I work in Dalhousie, which is my teaching role as a professor and as a researcher. And every year I have a couple of students that research with me. They've been coming to conferences now, and they do what's called research in medicine. So they come and do their research in medicine with me, and that could be in the zebrafish lab. It could be looking at anesthesia with the zebrafish or the gut. It could be somebody's doing now a research on POTS syndrome, so orthostatic hypertension syndrome, and we're looking at that, which is the autonomic nervous system. And then I've got the microbiome study on the go. So at the moment I have about 10 students with me researching along the spectrum of their medical training, maybe even more. I lose count sometimes. That keeps me going because I don't have to pay for my students. They come very cheaply, but they come with great enthusiasm. And I'm hoping that some of those take on the flag for CHARGE syndrome in the future. Many of the students that I've had with me who have researched or have been in clinic with me go out into the community, so they then know about CHARGE syndrome. I've got two young doctors that refer, that we look after a couple of patients between us with CHARGE syndrome, and they're GPs, and they've got a great knowledge of CHARGE syndrome, so they can really talk CHARGE. How I got into this was, well, I've been involved for 37 years now, over 35 years. It started at Great Ormond Street, Sick Kids, where I did a presentation on who's in charge, and it was because of Nicholas. He was a little baby. I remember Nicholas very fondly. He was with his mum and dad. He did eventually die on the unit, but I looked after him for 6 months, and he had a great life on he was on the cardiac unit. But people came in and out, whether it was the ENT people, the anesthesiologists, the, oh my goodness, gut people, they were in and out all the time. And I often said, who's actually in charge? Do you know who these people are that are coming in and out? So that was my first presentation. I've still got the original slides, if you want to see an original slide that goes in a carousel. One of my consultants said to me, why are you doing this work, Kim? Do something that's sort of more mainstream, because you won't make a name in CHARGE syndrome. And I laugh because I've absolutely made my name in CHARGE syndrome. And look at this. Who would have thought that I'd be doing this? So it's wonderful, wonderful community, amazing families, kids, young adults, professionals. What can I say? Thank you.